My name's Stuart Turvey. I'm a pediatrician at BC Children's Hospital and Associate Professor of Pediatrics at the University of British Columbia. I'm a pediatrician and the research I do really addresses important problems that are affecting children, and we study asthma. Asthma is the most common chronic illness of childhood. Major reason children come to our emergency room at BC Children's Hospital is for asthma attacks. And so we really want to understand what's causing asthma, because we've known about asthma for over 200 years, but the trouble is we don't really know what are the fundamental causes of asthma. And without doing that, we can't do what really is the ultimate goal, is to try and prevent the disease. And so to address that problem with a number of partners across the country, we've launched a study called the CHILD study. It stands for the Canadian Healthy Infant Longitudinal Development Study. And that's a study where we're really trying to understand what are the factors, what are the features that increase the risk of asthma in children. And to do that, we're recruiting mothers early in pregnancy, and then following up the mother, the father, and then the baby through at least the first 5 years of life. During that time, we collect biological samples. So what I mean by that would be blood samples from the mum and the baby. We ask about nutrition. We ask about the family's stress levels or socioeconomic status. We even go to the homes of the families when the baby's 3 months old, where we vacuum carpet and take samples of breast milk and urine. And what this provides is an amazingly rich biological library that then we can go and probe what are some of those fundamental differences between the children who ultimately develop asthma, and we make that diagnosis at age 5, versus those who don't have asthma. It's a longitudinal study. We've been going since about 2004, getting started. The children who are enrolled in the CHILD study now, the oldest are turning 3, but we're also still in the process of recruiting mums as well. We're going to have, when the study's done, we aim to have 5,000 families across 4 sites in Canada. So we're recruiting in Vancouver, in Edmonton, Winnipeg, and Toronto, to try and really get a feel for what's happening in early life of families and children as they develop in our Canadian cities. Working out what causes asthma is no easy task. Many people are working on that. So with our CHILD study, we've brought together over 70 investigators across Canada, spanning really all the elements that can be involved in the disease, from psychological issues to immunology, obstetricians, pediatricians, and others, and have brought this immensely knowledgeable and wonderfully collaborative group together to focus on this important question that's really affecting children on a daily basis. You know, as I said, asthma is the most common chronic disease of childhood, and it poses a very big burden for families because of children with asthma. Often in pediatrics, the children do relatively well, but then when a virus comes along in the wintertime, the children could experience a severe exacerbation of their disease. That takes the children to the emergency room or seeking other emergency medical care. It means that those children are out of school or out of daycare, and starts to impact both the health quality of life for the family, but also the economic productivity of the family, with missed days of work, missed days of school, and huge amounts of stress around dealing with this disease. So what our research really wants to do is to understand what are the factors, what are the fundamental features that are setting children up to develop asthma. And our vision for the future is that we will be able to address or modify those risk factors and start to prevent this disease.